A few words on asthma, as I've been asked to talk a little bit about that, and we'll go through a few aspects of asthma, including what do we think causes it, what sort of symptoms does it give, and how to manage it. Asthma is a condition affecting the lungs, and the lungs are organs inside our chest which help us to bring oxygen into our body when we breathe in, and to get rid of waste gases, particularly carbon dioxide, when we breathe out. Now, that needs air to come in and go out of the lungs effectively, and the lungs can be thought of as a series of tubes which across which oxygen goes into the blood from the air that's coming in, and the waste gases go from the blood into the tubes and get breathed out. Um, Now, as with any organ in the body, things can go wrong, and asthma is an example of a disease affecting the lungs. And what happens in asthma is that the tubes, if you want to think of them as that, become very sensitive to um, things that they breathe in. Um, so we have what we call triggers for asthma, things which can trigger off the lungs becoming affected and having an asthma attack. And what happens when a person with asthma comes into contact with something that potentially can irritate their lungs is that we see that there is a tightening of the tubes. So, how does that happen? Well, the muscles around the tubes or the airways get tight. So, a little bit like a pipe, if you can imagine the walls of a pipe coming closer together, then the amount of water or fluid or air that goes through the pipe gets less. But we also see things happening to the inside of the pipe as well, the tubes. They become a bit what we call inflamed, and you can develop some swelling there, which also reduces the amount of air that can go through the middle of that pipe. And we also get a sticky substance like mucus or phlegm building up, which can narrow the pipes even more. And as a result, that causes the symptoms that we associate with asthma, like wheezing, coughing, shortness of breath, and chest tightness.